ahead and start. We do have kind of the reports for you to look over. So that's in this packet right here. And then this is kind of step-by-step instructions. But before we kind of jump in, I know that besides the concussion, how have things been going?
Not too bad.
Okay. And I want to let you know that there are people over on Zoom. We have some of our other trainees and some of our family support navigators on, okay? How is Jonathan doing?
He's doing?
Doing okay?
He peed all over me this morning in the bed.
Oh, really?
Yeah, that's done that in a while. So, yeah. Like, hopefully it's just a one-time thing we're going to go through.
Yeah.
Yeah, I hope so.
Oh, yeah. Did he get good sleep last night?
He did better because I put him in bed at like 7. It took me about an hour and a half to go to sleep. But
Taking him a long time. But yeah. And he's still waking up a lot too.
not as much. I've been working on the how to sit on now. Making it away from me.
Good. Okay. Well, we have kind of a lot to go through, but before we go through everything, I just want to thank you for coming to all of these evaluations. I know it has not been easy, and it's been a really long process, and for you to drive all this way, it's just, you know, it's a testament to how much support you're giving Jonathan. So I wanted to just start off by saying thank you for letting us meet you and your family. He's been a pleasure to work with. We're going to be talking a lot about kind of what supports we can do for Jonathan, but I want to keep in mind, we all noticed a lot of nice strengths when we worked with Jonathan. So a couple of things that we noticed, I listed them on here too. A lot of our providers noticed that he was, you know, enthusiastic, energetic. When we engaged with him, he was excited to play with us and interact with us. And those are really, really nice skills that we saw for him. So even though we're going to be talking about all of the support and diagnoses and all of those things, I just want to say that he has a lot of nice skills. And we were just overjoyed to be able to work with him during our evaluations. Okay. We're going to be giving you a lot of reports, a lot of information. So just interrupt us at any time if you have questions, okay? This is really supposed to be about you leaving feeling like you have a good plan and that you have support from us. And that's really our goal today, okay? Before we start out, any questions that you have about what we're gonna be going over? We're probably gonna start with our psychology evals.
And I think just keep in mind with it, that's where his school will join as well. So they chime in.
We can get them on. I can double check and see.
Are they on?
They were trying to, oh yeah, there they are.
I
Hi
was gonna
guys.
say, I saw new people pop in.
Yep, they're right over there. So they're on there.
Yeah, it's been a while, I think since January, since we saw each other. So I am Kate, the psychology grad student. And just wanted to go through the things that we did, Jonathan, while he was here, all the information that you provided. You'll have a copy of this report and it's in my chart too. So just wanted to talk through things. I know it's long, so we'll kind of talk at a higher level, but if you have questions, just let me know. So kind of starting out here on these first couple of pages, the way it's organized is this is all of the background information that you gave us. So kind of giving us a good picture of what it's like to be with Jonathan at home, from your perspective, what he's like at school. And this was all really important information to just give us a good picture of what he's like, because we know it's different when you bring him in and we have different things going on. So thanks for providing all of that, because it's really helpful in getting a good picture. So that's kind of where the report starts and some of his developmental history. And then we go down and list all of the different things that we did with him. So I want to first talk about the cognitive testing that we did with him. So this was when he and I went to that little table and we were doing puzzles, blocks, some coloring, things like that. And his scores are listed here. And what I did with him provides kind of a point in time where he's at in his cognitive development. And since he's so young, we know that this could change. It's not necessarily stable or predictive over time, but it did give us really good information that overall, his cognitive functioning looks like we would expect it to for his age, which is great. So for the most part, especially on things that took a lot of verbal comprehension, so he had to explain things to me, or I was asking him a lot of verbal things, things performed just like we would expect for someone his age. Similarly, for some of the novel puzzles that we did. So that was when he was looking at patterns and had to pick out certain things or solve a missing piece of a puzzle. So we can tell he has some really great reasoning skills and some verbal skills. The spatial cluster was the piece where he was more playing with blocks or copying pictures. And that's a little bit lower, slightly below average. We'll talk a little bit about some PT and OT things that might be related to that spatial piece since it is more hands-on. Might also be these tests were later and his motivation and focus kind of waned towards the end, we know that. So not entirely sure, but in that is a little bit lower area that we might want to keep an eye on. But overall, seems like his cognitive abilities are right as we would expect them for his age. Again, like Dr. Abbey was saying, he has some really nice skills and some baseline to build off of. So then after that, I did with him what we call the bracket. And this is more looking at his academic or pre-academic because of his age skills. So his ability to recognize numbers, letters, more shapes, kind of some social awareness, things that he would be learning in preschool. These here, so these scores, an average would be 10. And as you can see, most of them are quite a bit below that average level. So it seems like even though he has, that cognitive ability and that baseline, he's missing some of these things that he's learning at school or just in life. And I think all of those reports that you gave us about his behavior and emotions kind of help us fill that gap. So what is going on between, we know he has the ability for it, but there's some kind of gap in him picking up the skills or learning them. And so what is going on there? So I think overall here, just kind of where he's at on those pre-academic skills and learning, a little bit behind for what we would expect for his age. I think that's pretty consistent with everything that you were sharing with us as well. Do you have any questions on that so far? Okay. And then the next piece, this kind of goes along with it, is his adaptive skills. So this was that red booklet that I gave you that had lots and lots of questions. You answered them, she got 5 zeros in a row, went to the next section. I know it's really long, but that information is super helpful. So thanks for filling that out so carefully. And that was getting at, so what are his adaptive skills looking like in a day-to-day context? What can he do to care for himself, to help out at home, to communicate with people? And similar to his academic skills, we see that these are a little bit behind what we would expect for his age. So right here, again, these scores, we would expect the average to be 100. So you can kind of see he falls a little bit below that in these different areas. I will say, so this is his overall adaptive composite, so it's just a little bit lower, kind of in the moderately low range. His communication, so that's how well he's understanding what people are saying to him and expressing himself, was a little bit lower, which might be where we see some of that frustration that he has. And then his daily living skills, he did have a little bit of a strength in some self-care skills, so he's developing some of those, like kind of helping out at home or how he's acting in the community. Again, it's just a little less mature than they would expect for his age. The socialization piece, I want to point out there's a few things that go into that. It's interpersonal skills, play and leisure, and then coping skills. His play and leisure and interpersonal were just below where we would expect for his age, so kind of along with everything else. His coping skills were a lot lower, so kind of bringing down that overall socialization score. So that's his ability, like you said, to just kind of roll with things, to cheer up whenever he's upset, to calm himself, to ask for help. And just like you said, he struggles with those things, and we saw that here too. And then motor skills was also a little bit lower. And again, I'm going to wait and have the PT/OT report speak to that a little bit more. So again, seeing here that these are the things that you learn, pick up from being at home and kind of working with people and being with people. And his cognitive score shows that he has the ability, he's there, but he's still kind of missing some of that learning, probably because those behaviors are getting in the way. When you're frustrated, when you're not able to regulate yourself, it's hard to pick up the things with people around you. Any questions about those pieces? So then we had you fill out some more things that were more about his emotions and his behaviors. So this first one is the VASC that just really is more closely to his emotions that you're seeing and that kind of functioning. And then his teacher also filled out a form that was just like the one that you did. So we kind of have an idea of what he's like in both of those contexts. On the information that you provided, we see that he is significantly high externalizing problems. So that's some of the aggression, frustration, hyperactivity is a big one that came up there. And then his internalizing was a little bit lower in your report here, and was seen higher at school. So some of that might be maybe withdrawal, maybe more tearfulness or anxiety seen, which we definitely heard from you. It happens in both contexts, but just reported a little bit higher at school. So from this, the main picture was that you see that he is struggling. He's having a lot of behaviors that are hard to keep up with, that impulsivity, the hyperactivity, getting really frustrated, and we definitely see that here. And the last piece we had you all fill out is this brief here. And this is a measure of executive functioning. And what that is kind of our own ability to regulate ourselves. So to plan our day, to organize, okay, I know I want this later, so these are the things I'm going to do to get it. Maybe stop ourselves a little bit from acting on our impulses, take a step back, kind of organize, roll with the things that we're doing. And what we saw on this, so his scores here, all of your reports and the teachers are in the clinically significant range, indicating that he's really struggling in these areas. So that self-control or inhibition or ability to resist, like, I want this, I'm going to grab it now, even though mom's told me no 100 times, like the ability to stop and remember that and slow down in the moment, he really struggles with that. The flexibility piece, so moving from one thing to another, also very difficult for him. And just kind of overall that ability to slow down and organize himself a little bit is tough for him. And I want to point out that this is kind of scored on a scale for his age. We wouldn't expect a 4-year-old to have great skills at those, but starting to emerge a little bit, and his are a little bit behind what we would see. Any questions about that so far? Okay. So when we see this kind of high levels of difficulty with executive functioning, the hyperactivity and impulsivity that comes with it, and that emotional piece is part of the executive functioning, not being able to calm down or having a really strong reaction to something. And that really maps onto ADHD, which we see with Jonathan quite a bit. And so that is where our assessment leads us for him to diagnosing him with ADHD. And we know that ADHD can be really, really hard for kids and adults. It, all the behaviors you're talking about, it can be just difficult. He probably knows that he's been told 100 times to do it this way, and he's not able to because his brain is just moving a little bit more quickly. And I know Dr. Abby will talk more about ADHD a little bit too. But that's really where we're seeing all of those behaviors, strong reactions. It can be quite impactful. I think sometimes people talk about ADHD a little bit flippantly, but we know it can be really hard for his emotions, especially at his development level, and his behaviors make it really hard for you and for everyone around him. What questions do you have about that so far, or kind of coming to that conclusion?
I think that makes sense with what you
I've
said.
heard of things already.
Yeah,
I mean,
yeah.
that I've already kind of always, even the doctors talk about it.
Yeah.
He's always done things. getting worse, the older he's getting.
Yeah, yeah.
So I kind of figured already, but I just didn't know like the rest of it, you know, if anything else is gonna fall.
Yeah. And we're gonna go through kind of the rest of, because there are other things that we see along with ADHD. Like Kate said, that there are kind of multiple areas where kids with ADHD struggle, but beyond that, Jonathan has more kind of going on than just ADHD.
You know, the impulsive thing that like he has, like the thing where I said, like, you feel like he has to do it, what you're talking about.
It's almost like when you say no and he hears you say no, he understands what the word no means, but he can't really help himself. It's like he kind of acts and then he thinks later, like, oh, mom told me no.
Yeah, it's almost like he has to let you know, like, you know, he's gonna be in trouble,
Mhm.
but he's still. That's what I try to explain to the dad sometimes, like, it's like, he knows he's not supposed to, but he has to, it's like he can't control not doing it.
Yeah,
I don't know if that was it.
yeah,
Absolutely.
that is a thing,
Yes.
and that's, that's a
Oh,
big part
yeah.
of ADHD. And I imagine as a parent, that is one of the more frustrating things, right? You're like,
That's like your daily thing, like you tell him no, but he still does it, even though like yesterday, I don't. Like, so now my room's off limits, like I'm trying to get my room off limits, because he's going through all of his stuff.
yeah,
You know, things in there, you know, just being all mess and my room locked up, you know, like I
Yeah.
don't leave the room.
Yeah.
Well, he continued on the room yesterday to go through our door. So it's like, he knew already that I was upset, do not go to my room, so it's
Yeah.
like he continued on my room.
yeah,
So it's like, what do you do then? Like, what am I supposed to do when he keeps doing it and I keep telling him not to and keep taking him out of my room? You know what I mean?
Yeah. no, exactly. And that's kind of where we come in and help you find an action plan, right? Because we know that that'll help you and him kind of go about your daily life, right? Because he's frustrated too, because I think he knows where the boundary is sometimes.
It's like he can't stop.
Exactly. Yeah. So that's a big part of ADHD. And we know there's other things at play there that are contributing to the frustration, but that's a very frustrating part for both parents and for the child. So yeah, that's something we want to kind of help you with. Yeah.
Yeah, and I think it's really a strength for him and for your family that you are seeing that and recognize it too. Like he knows he's there and it's hard for him and hard for you to see him then not follow through or just do it anyway. But I think it can be really helpful to recognize, like you are, that he's trying, he knows it's there, and so he's helping make some recommendations for that too. So with ADHD, I'm just going to give a couple of recommendations and some of his behaviors that we have from a psych perspective, and then Dr. Abby will kind of go through the rest of that too. But just sort of broadly for ADHD, we typically recommend a plan at home, a plan at school, and then a plan with the pediatrician. So looking into medication and seeing if that's a fit. So for the at-home pieces, one of the things for him is that behavior therapy will be really, really helpful for him and just helping him to kind of learn some skills and do some calm down things, and have basically that self-control that our executive functioning kind of externalize that for him and have him learn to do that, or have his parents and family learn and teachers support that executive functioning that he's lacking a little bit. So the behavior therapy that we recommend involves parents, and that's what we recommend for all people who are his age. We kind of know, 4-year-olds are not motivated to change their behavior. If we teach them for an hour what we want them to do and then let them go, we know they're not going to be able to practice on their own. They're not going to want to, and that's just too much to expect from a 4-year-old. So the behavior therapy that we recommend involves either you or both of his parents, so that you can learn the skills along with him and then help him practice those at home. We also know that ADHD just needs a little bit different parenting, kind of like we've heard you say and other parents say, I had other kids, I parented in this way and this child just isn't responding to it, or I don't know what to do with this child. And that's what we see a lot with ADHD, just all the things you're saying, they just respond a little bit differently. So we can kind of give you a few skills and tools too, to help parent him with the specific needs that he has. But the biggest piece of that, again, is just learning alongside him and being able, it's almost teaching you to be his therapist at home in the moment. And so that we can get those skills to last and kind of take over in his whole life, not just the hour that he's in therapy. So we do have a handful of recommendations, and our social work team will provide a list where there are some more local places that provide some of that therapy. And then the other piece is this group for ADHD, and it's really just learning about what is ADHD, what are the treatments out there for it. I think one of the things about ADHD that is on the more positive side is that we have so much research and experience with it compared to a lot of other childhood disorders. So there's this group here for parents, and they will be doing telehealth options throughout the rest of the year. So joining that group just to learn about ADHD, and I think sometimes parents find it really nice to be in a group with other parents who are going through the same thing. And can see this isn't just my child or my experience, but we're all really struggling with this and kind of learning and bouncing solutions off each other. So those are our biggest recommendations, and then sharing the report with school so that you can have a good school plan there too. And I'll let Dr. Abby kind of talk
I've
about the
kind of
rest
laid
of
it out
that.
step by step too, because I know that we can say we're going to tell you to do 20 different things, but I want to kind of help you with each step of the way too. But do you have questions about anything that we've just mentioned?
And like I said, I know this is a lot, and in this document too, so those main things I just said are under the plan of care. So we kind of think of that as the next steps. And then beyond that, these recommendations are just general things about ADHD. That's kind of more when you have time or you sat with the information for a while or you're ready for it. Some of these things too, they would also talk about in that parenting group. So you can learn that there or in behavior therapy. So those are there for you, but we also know, like we said, it's a lot of information. We wouldn't expect for you to like even be able to look through those or get through those right away, but it's there for you if you need it.
We're gonna move forward, but before we do, any questions about anything that he's just laid out for you? I'm probably gonna switch spots. That's okay. Good. More papers. There we go. We're gonna go through kind of the rest of the reports too, so that you have everything. So I know you're probably like, we did 15 different evaluations. What else did those find? And I think, have you read through the reports?
I read through some stuff, like the notes or whatever on my chart.
Perfect. Okay. So these are physical copies. So this is the psychology eval that you just went through. We are going to kind of go through each one by one. Okay. So when we looked at Jonathan, we looked at kind of everything. So we looked at hearing, we looked at speech, his fine motor skills, everything essentially that we could think of to look at. So I think before I jump into kind of the speech evaluation, he did have a hearing evaluation, if you remember, in the booth, which he did really well with, is what I was told. But so when they looked at his hearing, they found that his hearing was appropriate for his development and age. So that's a good thing. So they were recommending just routine hearing checks through the school and through his pediatrician. Okay. Do you have questions about the hearing evaluation? The other thing that also was normal for him is when we kind of looked into genetics, so looking into your family history, we had kind of a low concern for a genetic condition that was contributing to Jonathan's difficulties. Okay. So we were not recommending any further blood work or any further evaluation into genetics for him. Does that make sense too? So those are kind of two big things to kind of get out of the way, but important things for us to kind of rule out. The next thing that we're going to kind of go through is his audiology report. So the next thing we'll go through is his speech. So we knew going into it, thanks to you, that he had an IEP for a language impairment in his school. So that is good. And I want to commend you because a lot of kids don't get IEPs at a young age. And a lot of times that is parent driven. So parents having to go and ask for extra support. So I think that's great that you were able to get him set up with that, because that's a big first step, right? So when we look at his speech, our speech language pathologist kind of looked at everything. So the biggest thing, I'll kind of start off and have to go the tables if we can find them. So when we look right here, we found that Jonathan had a lot of difficulties with what we call articulation. So articulation is like how we pronounce words, how we use those consonant sounds. And when we looked at his score, so normal was anywhere from 85 to 115, and his score was 63. So he was severely below average for that, meaning that when we asked him, for example, to say a word like duck, he said duck. And when we asked about glasses, he said gases. So he left out some of those letters and had difficulty pronouncing. I think, does that make sense? Yeah. So we found a lot of difficulties with pronunciation of the words, right? And that can be really frustrating because it's hard for you to understand him, or for the school, and for him to be understood, right? So when we looked at his articulation, we found that that was severely below average. And so what that diagnosis is speech sound disorder. He had difficulty pronouncing those sounds, okay? And that was kind of consistent with what I think the school had looked at too. This goes through kind of the individual sounds that he had difficulty with. And then the other thing we looked at is we looked at how Jonathan uses language and also how he receives it. So how he uses language is what we call expressive language, and how he receives it is called receptive language, okay? And when we looked at his receptive language, we found that that was a little bit lower than average, so mildly below average. And we looked at how he uses language, that was moderately below average. So that was a little bit of a weaker point in his testing, okay? So he had more difficulty with the expression of language, which also goes along with articulation and other things like that. Because he had difficulty with both of those things, we gave him what's called a mixed receptive expressive language disorder, meaning he has difficulty with both understanding language and using it. Good questions about that. Okay. I went into kind of each category. So we looked at how he follows directions, how he's able to recall sentences, word structure. A lot of those scores were also below average. I will say his understanding of certain sentences was in the average range, so that was a relative strength for him. And this kind of goes into other things that go into language. We looked at also how he uses language socially, and some of that was a difficulty for him too. Okay. So overall, what we are recommending from speech therapy is we're recommending private speech therapy in addition to his IEP, okay? And the hope is that we can focus on really that articulation, the pronunciation of those words, but also understanding directions, using his words when he's getting frustrated, things like that. They can work on all of those things in speech therapy. And I do think, and you can let me know if you agree, that maybe that is leading to some of the frustration and behavior. It's not being understood. Yeah. So that is something that we're recommending. We did, this will be your action plan. So this is kind of number one is the private speech and language therapy. I did make an external referral, meaning a referral for your community speech provider. And what we did find when we looked in your community services, I don't know, I know that you were willing for the Kentucky speech therapy to come to the Kentucky Cincinnati Children's, but that is pretty far. So I also made it external for any community services. And I'll give you the referral for that. But the one option you have in your area is called A Step Ahead Pediatric Therapy. It's in Florence, which I think is where your pediatrician is. Have you heard of them before? Okay. So I put their website on here. They do speech therapy. And I also gave you the referral for that and also their phone number. So that's kind of how to call and schedule. And the one thing to know is that you'll let them know that you have a referral from your pediatrician, so from me. And then bring a copy also of the speech and language report, because they'll definitely want to see kind of what we found, okay? I did list some our speech language pathologist listed some speech and language goals that we have for him. This is really for therapy and for school to look at. So I would recommend, one, the school will get copies of these reports, but also just showing this to them, because these are really for his therapist to go forward. Okay, so that's the biggest thing. We are going to be recommending a lot of therapy. So one thing to talk about with his speech therapist at school is seeing what you can kind of do at home to keep working from what he's working on at school, so that you can also do it at home. Because we realize it's going to be a lot of therapy that we're asking him to do. Okay. What questions do you have about that? Okay. So that's the first report, and like I said, you're going to get a copy of all of these things. The next thing we'll go through is occupational therapy. So this was looking at his fine motor skills. They also look at a bunch of other things. So they look at sensory processing. They look at how he's able to do his daily activities, like dressing, feeding, those sorts of things. So they went through kind of a brief history, which I'm sure you remember. And then they went through kind of all of the areas of daily living. So that's feeding, bathing, grooming, things like that. And when we looked at his overall scores, one of the things I do want to point out is when we looked at sensory processing. So when we talk about sensory processing, we talk about kind of what's going on in the room around you. We know that some kids, like when they're in a noisy environment, it's escalated, right? They hear it a lot more strongly than we do, and things get overwhelming really quickly. So when we talk about sensory processing, we're talking about how they're exploring their environment. And when we looked at that with Jonathan, we found that he was often over responsive to sensations, right? So he doesn't like water on his face, loud noises. He likes to touch kind of everything, and that's how he likes to explore his environment. So we found that he had a lot of difficulty kind of exploring his environment in a typical way, and that's what we call sensory processing difficulty, because there's so much going on for him. That goes together with ADHD, but it's also a separate thing, right? And it's something that we address separate from ADHD too. So treating the ADHD doesn't always completely treat the sensory processing part of that, okay? Have you found that with Jonathan too, with the sensory, that he's kind of always in his environment, doing everything, yeah. So this is just a measure that we looked at to kind of see where he ranged for exploring his environment with sensory processing, and we just found that he was pretty over responsive and had challenges. So they were saying that he had presented with seeking behaviors, and that appears to be kind of negatively impacting how he's able to do his daily living, right? When we did look at his daily living activities too, we found some difficulty there, which I'm sure is no surprise to you. You had mentioned difficulties with sleep, obviously, so getting himself to calm down, but also difficulties with eating, gagging with certain foods, textures, things like that. So because he had difficulty kind of with these daily living activities, kind of like what Kate was saying earlier, we were calling that impaired ADL's activities of daily living. Okay, so essentially that means he needs a little bit more support from his caregivers, so you and dad, to do kind of basic living activities. And that is something that they found in the occupational therapy evaluation. Okay, that is something that they can work on with him. So it's something that doesn't need to be just done in the home. So they can work on like feeding, they can work on emotional regulation, getting him to kind of calm down when he's getting kind of overexcited by his environment. All of those things occupational therapy can work on with him. So that is something that we were recommending going forward. And then the last thing they kind of looked at was fine motor skills. So fine motor skills at his age. So that is kind of pre-writing skills. So being able to draw circles, shapes, being able to feed himself, that's also kind of a fine motor, doing buttons, zippers, those types of things. And when we looked at that, we had kind of, because we had to kind of look at it broadly, we found that he did have some difficulty with those fine motor skills. Okay. I don't know if they put, may or may not. We did see pictures of kind of what he was able to draw for us. And we did find that some of his drawing skills were a little bit younger than what we would expect for his age. So some of those fine motor skills are still emerging. So that is another area that we would like to work on with him, is helping him to kind of use his hands and be able to coordinate those movements too. Okay. Those are the biggest things that they saw. So when for occupational therapy, we were recommending occupational therapy, so once weekly for 3 months. The one thing I will point out is behavior obviously is the biggest concern right now for you and for us too. So we want to make sure that we get behavior under control first, that he can get everything he needs out of all of these therapies. So the one thing our occupational therapists do recommend is doing behavior therapy before we do occupational therapy. Okay. Does that make sense?
Yeah, the school's looking into this occupation.
Perfect.
On this, so we get that.
Yeah, so they're definitely going to want to see this report. We did put some, just like we did with speech, we did put some initial goals that they recommended and things to work on. So if you go, I know this is a long document, but if you go to occupational therapy, these are kind of initial recommendations, and this is good for the school to look at so that they can see kind of what we saw. I do think he can be helped by occupational therapy in the school if that's what they find in their evaluations too. But then after behavior, I do think also doing occupational therapy outside of the school will be helpful to him. So like I said, I want him to get everything he can get out of it. So I want to make sure we get the behavior first before we do that. Okay. It's similar to speech, so it's a step ahead. Pediatric therapy is the same place. Same number, and I'll give you a referral just like I did for speech for that. Okay. A lot of information, so I'm going to pause and see what questions. Okay, you feel like we're giving you a good game plan?
I just feel like.
Hey, Hannah, you might want to hear a familiar voice after all this for a second. So we were looking up the therapy place that they're suggesting for the speech and for the OT, and both of those are on Cavalier Boulevard, which is kind of where Boone County High School is, where Sports of All Sorts used to be, behind Frisch's and things like that. So it's actually not too far. It would be closer than the Northern Kentucky branch for children's. So maybe that might help you not be so overwhelmed. There's a lot of pediatricians' offices there. Do you know what I'm talking about?
It's not by the nurturing center, is it? That where,
Do you know where Big Lots is?
yeah,
It's across from there.
okay.
It's like back on a little side road. You can see it from the interstate. So you get right off the exit. If you turn to left, it would be to where Cracker Barrel is and Applebee's. And if you turn right, it's like 2 minutes from there. So my children actually go to the pediatrician on that same road, and that's where my chiropractor is. So it's really nice if you hit the interstate to be able to get off. And I know you're thinking about that with your work schedule and appointments and things. So that's one plus. But me and Samantha are here. We wish we could be there with you. So I just want to let you know that we're on it to help in any way too, as we hear all the information and can help with the transition with the district and making sure they get copies of stuff too. So, okay. All right. Sorry. I just had to reach out for a second because.
No, thank you so much. We appreciate it. It's good to kind of break up. I know we're giving you a lot, and I hope that when we leave that it won't just feel like a checklist of things that you have to do. I'm going to try and prioritize it for you before we step away so that you know, like, you're like, I can possibly do 500 therapies, so you know what the priority is. Okay. So bear with me. We're almost there. I promise. Okay. How are you feeling right now? You're okay. Do you need a little break? Okay. Do you need water or anything? Okay. So we have one more report to kind of go through before we get into my assessment. Okay. And the last thing we're going to look at is physical therapy. Okay, so we knew when you came into it that he had had experience previously with physical therapy. And that is a big concern, right? He has that toe that turns out and then those weak ankle ligaments that you've been told about previously. So when our physical therapist, she's actually on too, our occupational therapist on watching this right now, when she looked at we look at all things. So we look at his strength, we look at how he walks, we look at his coordination, kind of all of these things. And when we looked at all of that, we did find some areas where we feel like he needs some support. Okay. And so when we went through each of his things, we found that he did seem to show a preference for his left side versus his right. And that's probably because what we found was that right side was a little bit weaker, which I think is hopefully consistent with what you've seen previously. So sometimes kids, when they have a weaker side, they tend to compensate by really preferring that other side. And that's what we were finding was going on a lot with Jonathan. Okay. So when we looked at he used his right leg to kick, but he needed to balance on his left leg. When we looked at balancing between the left and the right side, he, on both sides, had a little bit weaker balance, but definitely more so on that right side. Okay, so when we asked him to stand on one foot, he was only able to do a second or two on the right versus 2 to 3 on the left. Okay. So that was something that we noticed. We also noticed that when he was walking, we saw a little bit of what we call foot drop, where have you noticed that? Yeah. Yeah, so we're still noticing that. And that can contribute to tripping. That can make it harder for him to run, walk, all of those things. And there's a lot of reasons why that could be, but for him, we think in his case, what he needs is those muscles down there are a little bit weaker. The muscles in the right foot are a little bit weaker. And so what we want to focus on is kind of strengthening that whole right side, to hopefully even out the balance a little bit more. And that's kind of what we had recommended. Did you get the home exercise plan? Yes, yeah. So it goes through exercises that can help with strengthening that right side. So it can help with balance, but just overall strength and walking, all of those things. So that is something we are recommending. We do, when they went through kind of everything. So sitting, standing, we looked at kind of his ball skills. We found that he was actually pretty strong overall, considering even with the right side being a little weaker. So he was able to push really large objects around.
You don't really want to follow.
Yeah, he's definitely compensated. He's still able to go around and do his daily activities. So when we looked at all of those things, we still were quite impressed with his strength during his evaluation. So what we're recommending is we are recommending doing the home exercise plan. So the goal would be like 3 to 4 times a week to be able to do those exercises with him at home. And then from there, we would recommend checking in with physical therapy. So we are referring to physical therapy to see them every month to kind of tweak his home exercise plan, see how his strength is going. Our hope is if we can strengthen that right side, that he won't need orthotics braces going forward. So we're not recommending braces right now because we're hoping to see if we strengthen that right side, does he still need them later? So that's why physical therapy will be so important, is they'll be checking in every month to kind of see how is it going? Do we need to consider braces or orthotics, things like that going forward? Does that make sense? Okay. So that is a referral that we'll make. It's the same therapy place. We're thinking just every month for right now. And then once we've kind of also gotten behavior, we've addressed some of the bigger issues, recommending more frequently to help with strength. So every week after that for a couple of months. But we'll start with every month just to make sure the home exercise plan is going well and he doesn't need orthotics going forward. Any questions about that? That is, and I think this is also our therapy trainee wrote out kind of some exercises that she had sent to you. Okay, so I'll give this to you. I think also if you go to this link right here and you put in this code, it'll take you to this home exercise plan. plan so that you can see. It doesn't need to be an hour a day. It can be kind of short bits, 15 to 20 minutes, whatever you need to get through some of these things. Okay. So even if we can make a game out of it too, that'll be helpful. Okay. Questions about physical therapy? Okay. You're almost done, I promise. I know this is so long. You're doing a great job. Then kind of getting to the end now. When I met with you guys, I also shared concerns about ADHD.
I can't remember which one I got. Yeah.
That's okay. It was the day he had his hearing checked.
When we were, when somebody else was in there for the genetics.
Genetics, yep. Yep, that's when you met with me. So there was like the big bed in the room. Do you remember that?
Yeah.
Yeah. So we met and I definitely saw signs of ADHD with him, right? He was a little bit, if you remember, shyer to engage with me. And he was definitely close to mom during that visit.
And then he warmed up really quickly when you wanted to do something.
Yeah. But that's okay. We got to see exactly what you were seeing at home, which I think is a good thing, right? So I also had concerns for ADHD. I saw a lot of hyperactivity and inattention, and we were seeing that kind of across our evaluations. So ADHD, as you've already kind of been aware of, but it's developmental, so it starts in early childhood. And for a lot of people, it continues throughout their life. And we see difficulties with attention, hyperactivity, and impulsivity, kind of all of those things. What goes along with it is that executive functioning, so planning out our day. And we also know that it can cause social difficulties because if you can't focus on a conversation, it can look like you're not socially engaged, right? So we know that it can cause social difficulties. We know it can cause issues with school and learning. Because if you can't focus, how can you really learn some skills? Yeah. So I want to emphasize that we see it impact kind of multiple things. We see it with behavior, we see it with learning and social interactions too. And I think you're seeing that kind of in all parts too for Jonathan. Is that correct? Yeah. So we want to kind of help support you with that. Like Kate was saying, we talk about a home plan. So we talk about things you can do at home. We talk about school accommodations, and then we also talk about medications. And those are kind of the three biggest things that we talk about. So I put some things on here for you, just some websites. I also want to emphasize something that may be helpful for him is the retell start check-in system. And this is where if you're asking him to do something, retelling it to him, making sure that we've said it a couple times so that he understands it. And then trying to see if he understands what he needs to do. So helping him to get started. So if you're like, I want you to put away your box, you say, I want you to put away your box. And then what are we doing right now? Are we putting away the box? Kind of your retell. And then helping him to get started. So helping him put the box away and then kind of easing back to let him complete that task can be helpful. And so this is something we don't want it to be like a punishment. So we want to kind of make it something where you're interacting with him, he's getting some good attention out of it, but we're helping him to get the task started so that he can at least start, because sometimes that can be really difficult. It's just even getting him to start doing what we want him to do. And then as he's putting the box away, checking in, being like, are you putting away the box? Or good job putting away the box. That's kind of a helpful way to make sure that we're giving him these prompts to remind him to stay on task. Does that make sense? That may be something that you're already doing at home, but it's, I think, a really helpful way to make sure that we're keeping him on task. Okay. I put some classroom accommodations, so just making sure we're keeping a routine. Sometimes sitting towards the front of the classroom near the teacher can be helpful. All of these things the school may already be doing for him, and they may be planning to implement that for next year too. But that is something that the school can look over. And then frequent breaks. What we found is that Jonathan did really well when we gave him what's called like motor breaks, where we let him kind of get his energy out for a minute, and then we're like, okay, we're going to go back to our task. So we found that using that energy in short bursts was actually really helpful to keep him on task. So that's something the school can do too. Okay. You have questions about any of that? And then the last thing we wanted to talk about, I know that sleep has been kind of an issue long-term for you guys. And so we do always talk about medications for ADHD. Are you familiar with meds for,
I've always been Adderall.
what did you say?
I've always been on Adderall.
You've always been on Adderall. Do you like Adderall? Does it work for you?
Yeah, I took it through school.
Okay.
And then like recently, I'm talking to somebody and we're gonna start it back up.
Okay. Yeah,
I was on.
something. Okay. And it's been helpful for you, it sounds like. Okay. So that is something, we have a couple different, and there are a lot of ADHD meds, so I want to make sure that we show you. This is a lot, so just pay attention to the colors, okay? Just pay attention to the colors. So there's a couple different classes of ADHD meds. You're on Adderall, which is a stimulant, right? So the Adderall falls under this green box right here, okay? And then the other option for that green and yellow, they're both kind of Adderall variants. The other option is within this peach color, and this is something you may have heard of, Ritalin. Have you heard of that before?
Yeah, I didn't.
You don't like Ritalin? Okay, yeah, so Ritalin is the other class. So Adderall is one class, and Ritalin's the other class. Didn't work for you.
I don't want my kids all have to do it for them.
That's okay, and that's why we have multiple classes, right?
I guess because I've had so many people with bad experiences with the Ritalin stuff, and then I didn't do well.
Okay,
I'm kind of freaked out, like not even.
yeah. No, that makes total sense, yeah. And that's why we have multiple classes, and that's why we talk about these things. So we'll focus kind of on the Adderall side of it. So this is the amphetamine class that falls under that branch. Those Ritalin and Adderall are actually cousins of each other. So they're similar, they're not the same as we've experienced. Yeah, I'm sorry. I thought you were gonna say something.
No, just.
Okay, yeah, so the stimulant class is one option for ADHD, and that's the Ritalin Adderall. And then the other option are these non-stimulants. So that's the purple box right here, okay? And so he is very young, but we do find that kids with ADHD, sometimes parent training, behavior management, that's not enough. And we do find that medications are sometimes what we kind of need to keep us going, right? And to make sure that he's learning and engaged, all of those things. So sometimes with younger kids, we do think about this non-stimulant class. And so for him, the medication that I think might be helpful for him, and you can kind of let me know what you think, is something called clonidine. Have you heard of that before?
Yeah, I think my mom said no.
Your mom said no? For you?
No, for him.
Oh, for
My
him.
brother's on this chart.
Got it, okay.
My mom's a nursing. I think she said no.
And that's okay, because we'll give you information about all of these options so that you know. So why I like clonidine for Jonathan is that I like that he has these sleep difficulties, so it can help with sleep. It makes you a little bit sleepy. We would give it at bedtime. It's short acting, so it probably would wear off by the time he gets up in the morning. But it would help, one, with his sleep, which I think will make everything better. It'll make his behavior better. I think it will make his inattention, hyperactivity, all of that will, I think, improve a little bit with better sleep. So that's why I liked clonidine, and we also use it to treat ADHD. So it's kind of two birds with one stone, if that makes sense.
No, I totally disagree with you.
Okay, yeah.
I'm just gonna be flat out.
No, yeah, please.
The sleep's not, I'm so tired of hearing about sleep.
Okay.
Like even his doctor says beyond sleep at this.
Okay.
Because even when we first started the melatonin and he was sleeping all the time, like he slept really good. They even got worse.
It even got worse.
Yeah, and that's the reason why she even probably recommended me to you all, because I was like, we're sleeping all the time, we're doing good now. And it's getting worse. And that's the reason why she's seen it even in the office, and she's like, even that day, like she wasn't even seeing him, she was seeing his sister, and she stopped what she was doing to go call, figure out what we could do.
To go see what we could do. Okay.
Because I said, look, we're sleeping, even like his dad, like, dude, he sleeps, like, she's been doing good with him, like, he's gotten worse and he's getting more sleep.
Yeah.
And I was like, I don't know, it was just the, why really? But now that he's getting, the better the sleep is getting now. Like the last couple of weeks, we've been doing a lot better with sleep. It's gotten worse.
It's still worse.
Like, we went to the ARC. We went, or Tuesday, we went Sunday, and I was doing the ARC for him, and I was so there.
Yeah.
And I was like, And I was like, I made sure he went to bed, like I don't want no excuses like for him to be tired, you know, no
Yeah.
water and all that. And he didn't, and we were good for first like 20 minutes-ish, and then we were done. Like, I really don't think it's sleep.
Okay,
I don't
yeah,
100% don't think it's sleep.
yeah, and you know your kids better than anyone
Yeah,
else.
and because they this, like the kid took 20 milligrams of melatonin the other day. So in my room, there was one for him. Well, he went up and got another one. He took 20 milligrams, went to sleep. So this was at night till like 8 o'clock the next morning and still was.
Still did not work. Okay.
Yeah, so I don't really want to think it's sleep.
Okay, yeah, and I hear you. So let's pivot away from that. Let's not talk about the sleep as much. Let's look into the other non-stimulant that we recommend that is not a sleep aid. So it can make you a little more drowsy, but that's not the purpose, is to help with sleep necessarily. It's something called guanfacine. Have you heard of that? Okay. Yeah, it's sometimes called 10X or Intuitive. Not heard of that. Okay. So it's a similar class to clonidine, so similar medication, but we don't use it as sleep and it doesn't make you as sleepy, but we do find for some kids, it does make you a little sleepy. We typically, for that medication, we would give a short acting version for his age, meaning it lasts like about 4 hours at max. And we would give it in the morning and it helps with ADHD symptoms. It's not a stimulant, so it's not like Adderall that you're taking, which is also an option. We can also,
I guess I want something more him to have a last day at school.
something to make him last all day at
Because
school.
because I'm going to be working this summer, he's not early in school, and I want to need to be able to have somebody to handle him
Yeah, okay.
for at least 8 hours.
Do you think that what will he be doing in the
I
summer?
don't have food,
Okay,
because no one wants to eat him.
okay,
Where they can't control. My dad has him right now, and he was already in nursery before I even had him.
got it.
Because he's just so hyper and nobody can keep up with him. Like, my dad's just pulling everything.
Yeah,
And so like even his dad the other day brought him to the doctor's office and they were like, here you go, I don't know what to do with him.
okay, okay,
So I'm like, oh, okay. Like even the doctor was like, yeah, I knew that one gonna last.
okay.
Because I don't know, I need something to be able to help somebody keep him kind of I won't drugged up. I
No,
just
yeah.
want him like function.
Yeah,
And
and be able to
to
control his
chill.
behavior a little bit better. Yeah, I hear what you're saying.
So I don't know like how to go about that. I guess it was my best thing. And then I was talking to like
Yeah, the family
that was my
navigator.
big thing, like
Yeah.
they did good, something to help me at least 8 hours for somebody to keep me. Other than that, I don't care how you usually as long
Yeah.
as somebody who was home at school and help me like watch you learn the day.
Okay. And the good news is we can do these short acting medications. The difficulty is at his age, insurance won't cover a long acting right away, but we can do the short acting multiple times a day so that it can carry him through the day. We can tweak that so that we can make it last a little bit longer. So that is not a problem. And I hear
That's
what
just
you're
my
saying.
biggest thing.
Yeah,
I don't want my biggest for first 4 hours and then it's 8 hours.
Yeah.
I do.
you want it to last through the day. Yeah, we don't want to
And
see
then
these.
really at
dips.
home, I do care, but I don't care as long as I can get him through the day. Like at school or if somebody needs to keep him for me while I work, you know. what I
Yeah.
mean?
Do you have a preference? So the 10X, the guanfacine that I was telling you about, we can do that multiple times a day. It is similar to a stimulant. It depends on the kid, how well they respond.
I don't remember.
Yeah. Yeah,
I have to.
and if you'd be willing to try it. So let me tell you a little bit more about it. So the biggest side effects we talk about is it can make you a little sleepy. We don't want him to be overly sleepy, right? That's
Yeah,
not the
that's
goal. So if you're seeing that and you're like, he can't even stay awake during his day, let us know. Because that is not the be all end all.
Okay.
Okay. So that's the biggest side effect we see is sleepiness. It can cause a little bit of stomach upset, stomach aches, or constipation. It's something we think about too.
He's already has.
And he always has, yeah. So that's why we start at low doses and see kind of how they do. Because like I said, we don't want any side effects to be making anything worse, right? That is not the goal.
Yeah.
So if you're noticing, those are kind of the biggest side effects we see. If you're noticing those things, then we could always change, back off on the dose, do whatever we need to do. The other thing to know about it is it's a very, very weak blood pressure medication. So that was originally what it was used for. So we always watch blood pressure when we start this medication. It's so weak that we would never use it for anyone to control their blood pressure, but that was originally what it was found to do, is help with really high blood pressure. The things to look out for with that would be is if he was having dizziness, if he ever fainted, if he ever seemed like he was kind of out of it, dazed. Those are things that we would want to check his blood pressure and make sure.
Like, so I can tell if I have blood pressure. Okay.
Yeah, and we could give you kind of a goal for him. I would not.
Just because I'm not like that confusing, that it comes right now already.
No, yeah, I know.
So I think kind of.
Yeah, I want you to know all the side
I don't know
effects.
what anxiety, like, kind of long.
Yeah, no, I
You
know.
know what I mean?
Yeah, I want you to know all the side effects. Rarely do we ever have issues with kids who have normal blood pressures to start, which you did in the office, have blood pressure issues on this medication. But I want you to be aware of everything just in case. And I can put a blood pressure goal for him too if you want, but we rarely see that be an issue. Okay, so that is the one option, is guanfacine or 10x. The other option is to do a short acting like Adderall.
I don't really care, I just don't want to do quantity.
Okay, okay.
I just know Adderall because I've had such good experience with it, and so is my family that's been on it.
Yeah.
Whereas like our first thing was like Adderall and Maclay, because we've all been on it, we all have known it,
And it's worked for you guys.
and it's worked for all my family. I just know Ritalin, they always wanted to try it, so we've always tried it, and we did really good with it.
Yeah.
But it really don't matter to me. I just know Adderall is one reason I've always been more like Adderall.
Yeah.
I've never tried it.
Okay. Would you be willing to try the short acting
I
guanfacine?
mean, yeah, normally I don't really care. I just think.
Yeah, that's what's worked for you in the past.
Yeah.
Yeah.
All of our families, so.
Yeah.
It's on there.
Okay. And if you're willing, we can prescribe it today. I did talk with your pediatrician to see if they'd be willing to prescribe it going forward. And they were open to that because, yeah, yeah, that's who you see. Yeah. But, yeah. So I did talk with her. And she was willing to prescribe it because often what we have is a couple of different medication checks. So usually after we start a medication, we see you back in a month just to see how everything is going. So I realized that coming here every month may not work for you, but we're open to starting it today and then having you follow with your pediatrician, and we'll be checking in about every 6 months, sooner if need be.
Okay.
How does that sound? Okay. And I want to make sure we have the right pharmacy, everything, but that would be probably where I would start, is with the guanfacine 10x. If you don't like it, let's rethink and we can look at the Adderall. Okay.
Yeah, is that like a little pill where I can put it in something?
Yeah, you should be able to crush it. But yeah, you should be able to crush it and hide it. I don't know if he likes to do like applesauce with the name. Yeah. You should be able to. And we would do it twice. We'd start twice a day so that we can hopefully carry him through the day. Like I said, if you're seeing it wear off, they'll let us know, because we want, your goals are kind of our goals here. So we want to make sure that we're getting us through the day. Okay. So that's one piece. The other piece is the behavior therapy. Yep. And I put how to kind of find that on here. Kind of two options. So those, I put their numbers, and then this is Dr. Chuck Lindemann. I don't know if you've heard of him. He has a website actually, and he prefers a few schedules through his website. But he is willing to do behavior therapy. We didn't really tell them too much about Jonathan because we can't, because of privacy. But he was saying that he does do therapy, behavior therapy with kiddos Jonathan's age. It's not through North Key. He's a private.
No, I thought you said we were doing everything at one place.
Oh, that's for the other therapy. So speech, occupational, and physical are through the other therapy. But he just does behavior therapy. Okay, so that's who I would start with. So I listed out kind of our priorities here. I summarized. You go to here. So I think our priority that we're recommending is we'll start the medications today. Behavior therapies would be the priority otherwise, to kind of give you skills and give Jonathan skills. And that is really going to be best done if your dad or whoever is watching Jonathan consistently can go to that or be a part of some of the sessions, not all of them, but some of them. That's going to be the best thing for our buck, if that makes sense. So anyone that can be there present for it is going to be the best to kind of help us because we want to be consistent across providers. So that's the biggest thing I would say. We'll do the medication. I would say speech and language therapy is a big need for him. So if you wanted to look into another therapy, that would be where we would start. For occupational, like I said, after we address behavior. So that will be a little bit later down the line. Okay. Physical therapy, similar. But if you wanted to check in monthly for physical therapy to make sure everything's going fine with the home exercise plan, that would be where we would recommend. Okay. This goes over the medication, but I'll change it around so that we do the 10X. Okay. And then sharing a copy of the evaluation. Okay. Let me update this for you so that we have the current medication we're going to start. Okay. Does this sound like a plan that you feel like you? Do you have questions, concerns, anything where you're like, this is going to work? Okay. You feel comfortable with everything? You guys good too? How about this? Okay. Okay. Can I get you an updated form really quick? And I know you guys have already been here a long time, so. Yeah. So this is the long-acting version of it. It's called Blanfacine. If you see it right there, I'll get you a medication form too. That has all the stuff on it. And again, if you don't want to start it today, we don't have to. We can always give you some information about it.
I was on.
Okay.
She's my.
Yeah, no, absolutely. Yeah. So I'll get you information about it and I can send it to your pharmacy. Okay.
Okay.
And then let's start there. And then we'll meet back. We'll see each other probably about every 6 months.
Okay.
But I'll let your pediatrician know. They'll get all of our notes about what we talked about, and I'll touch base with them to let them know what we're starting. Okay. That sound like a good plan?
Yeah.
Okay. Let me step out really quick to get you an updated thing. All of these are going to be yours. These are yours. I'm giving you a lot of information. And then I want to make sure you have the referrals too. Okay. So these are the referrals for speech, for occupational and physical therapy, and they have them all listed right here.
Okay.
But they're all going to the same place.
Yeah.
I will be right back then for you, okay? And then this is a general guide to ADHD meds. So it covers kind of everything we talked about. Okay? I'll be right back with your updated form. This is for you to put all of the stuff I just gave you. And I'll be right back, okay? Okay.
Will we receive copies or will Hannah bring those to us as far as to share with the district or?
We can print out additional copies for you guys if you'd like.
Okay.
She'll also have copies of it, but we can also give her another set of copies.
Okay,
That
that,
would work
that
for
may
you
be easier on her and then she's picking up her younger
Yeah.
children today. We could go
Yeah.
ahead. Okay.
No problem. We can do
Thank
that
you
for
so
you guys.
much.
Thank you so much for meeting with us and sitting in.
Thank you guys.
Yeah, we really appreciate it.
Absolutely.
I'm gonna step out for just a minute, but if you guys have questions or you want to talk, I can leave you guys on, okay?
And I just wanted to say too, if you get signed up for behavioral therapy and they want a copy of this, let us know. You can print it from them from my part, or we can send them another copy too. Thank you.
Are you doing okay, Hannah?
Yeah.
Are you overwhelmed yet?
Yeah, so how would it work though with the medicine?
Yeah, so are you asking, can it be given at school?
She said twice a day.
Yeah, so we'll just we have paperwork that we'll have you complete so it can be given at school.
Okay.
Do you need Dr. Genco to sign a medication school administration form? Do you want to send that to Shannon? And I'm
Sure.
Marta. I'm Shannon's supervisor. I realize you guys probably don't
Hi.
know that. You
Shannon's
can
been awesome.
if you have it in electronic form, you can email it, or I can give you my fax number.
Okay. I will get it and email that to Shannon.
Perfect. And then we'll get it to Dr. Genco and we'll send it back to you.
Okay.
So that's how, that's the like whole circle of getting the meds given at school.
So it's twice a day. What do you take it at, like before school and then maybe after though? Because it's such a short period of time where we let out at 2. Would he need it during school hours?
Probably
It
because
depends on-
it's a stimulant, correct? So you're not going to want to give it too late in the day.
Right. Well, when Dr. Genco comes back, we'll clarify with her, like give us some time frames, but you're right. We don't want to give a stimulant too late.
Yeah.
Because
Yeah,
then
because it's
you
only
might not
4
sleep.
hours. Because she said it's only about 4 hours. So if I give it to him
Yeah.
at 7,
I'm thinking around 11 or 12.
And
somewhere
then
in
hopefully
there.
that helps the afternoon a little bit.
Sure.
yeah.
Okay. Let me.
But I'll ask her to clarify that up a little bit for us and then
We can
send us
share
the
those.
form.
Yeah, we can share those times too, because we have rest time at 11:30. So that might affect like when you want to give it to them and things like that too.
So it's kind of like whenever you all, I guess, the afternoon time, whatever you all do, because I don't know your all's times to sleep and all that. So
When they prescribe it, there's like an hour window where you can get it before or
Within
after
that.
that.
Okay.
Within that hour.
This has been very helpful. This whole team has just been really amazing to be able to be a part of. So we thank you guys too.
Yeah. I know like you're gonna get copies. We'll get to the copies of the evals. If you've got questions, let us know. I know, Mom, you already read them. They're a lot of information. And they're written in like our words, not so much family friendly words necessarily. So it can be a lot.
Well, and the school's doing an evaluation too.
Okay,
So
good.
I figured that a lot of the information would be beneficial for them. Some of it they
absolutely.
may be able to use
That would be great.
alongside, what they're doing to see what he qualifies as far as with the school.
And I just wanted to clarify too, real quick. I know initially, I think there were some concerns for autism. And so I just wanted to speak to that. As I went through, kind of talk, we did not see any of that, but specifically, some of his social skills, like initiating, so starting a conversation. He responded really well socially to me and to some of the other providers. We saw that with you, kind of showing you different things, like something he was working on or a toy or something. So those are all really nice social skills that we don't see with autism typically. And then the other piece of that is like stereotyped or rigid behaviors or speech that we see over and over and over again, which he doesn't seem to have. And the speech that he did have or the actions were like new to the situation or unique. So he wasn't repeating just words that he had heard before or TV lines or something like that. He could have a back and forth conversation with new words that he was kind of putting together. So just wanted to make that really clear too. I know I didn't say that earlier, but so that's why we didn't have any concerns for autism, just some of those skills too. Did you have any questions about that piece?
yeah.
Okay.
I pretty much knew, like we all kind of knew it was my ADHD. Like his doctor already told me that, but kind of the whole make sure it went over like other things.
Yeah. Well, and sometimes it can look different with different kids too. So I think definitely agree with your dedication and willingness to make sure we get to the bottom of it and get him on a good treatment plan.
Yeah.
So I think that will be really great for him. Definitely a strength. So yeah, hopefully, I know it's overwhelming.
Yeah. That's why, like Laura, the teacher, Laura over there, and then Samantha, she's the behavior specialist
Okay.
right there. Great. There's a lot of child there. Laura's been there with Johnny for, what, 4 years, I guess, since he's been young, baby.
Oh, wow. Yeah.
She's been there. So, she's seen the ups and downs we've been trying to go through, so.
Yeah.
And Jay actually got two of my other kids right now. My baby and my 2-year-old,
Yeah.
and then they have my 8-year-olds, and they've had all my kids.
Okay. Good to have people like that in your corner, and
Yeah.
supporting the families.
That's what I told them. I didn't know if it was just a home thing or if it was at school too.
Yeah.
You know, they're always different at home.
Yes. Yeah, definitely.
So I was like, and then she started talking to me about.
Yeah. Well, and even if there are concerns at home and school, sometimes even that looks different. So I think hearing from all the
I
people.
think
is
my
really
biggest thing too is like the developmental, like not knowing his colors, and I feel like he should know his colors because he's been in school since he was 6 weeks old. Like stuff like that really bothers me.
Yeah.
So I'm hoping if we get him more kind of chilled out, he would be able to learn it more is what I'm hoping, but.
Yeah. And I think that's our hope too, with both the medication and getting some behavior skills on board with him. But yeah, because like we said, we know he's got it in him. We just got to slow him down enough so that we can,
Yeah.
so he can keep it.
I'm back with your updated paperwork. Not that you need more paper from us.
Hey, Marta. I just want to let you know I sent you a message in the chat.
No, you said that medicine is about 4 hours.
Yeah, so it should be about 4 hours.
Because they were trying to figure out like what times they would try to give it at school.
So if you gave it, when does he get up in the morning?
So I will drop him off to his grandma, take him to school at 7.
Okay.
He gets to school like 7:30ish, I think.
Okay. So it's up to you. So we do have families that give both doses at school, but if you wanted to give it at 7, and we could give it around lunchtime. Taking the medication. Okay, so if you wanted to try it at home first, right? And you could try it on the weekend to start with too, if you wanted to.
Because he's all fall asleep with spring break.
Oh, perfect. Yeah, so this is a good time to
And
try.
then I'm trying to figure out, because they take a nap, I think she said 11:30.
Yeah, 11:30.
Okay.
He has lunch at 11
I'm
and
emailing it to Shannon right
then
now.
11:30 is rest time.
So if you gave it at 7 before we go to school, and then we give it again at like 11, we can give it anywhere from 11 to 12. So it probably won't make too much difference. Like I said, it just kind of calms them down, slows them down. So it shouldn't interfere too much with nap time.
Okay. I guess that was my biggest thing. It wouldn't interfere with nap.
Yeah, so you could give it right before the nap and that would be fine. You can also give it after the nap and that would be fine. It's really dependent on when you see it wearing off.
Okay.
So, well, perfect. Thank you so much. So, the plan maybe we give it at 7 if you're comfortable with that, and then we plan to give it like around lunchtime at like 11, and see how that carries us through the day. And then if we're noticing every kid kind of works through medication on their own, so some kids metabolize it really fast, some kids metabolize it really slow. So just let us know if you feel like you're wearing off, and we could push back the medication. Like if you still feel like you're seeing effects at 11. That's where the school is helpful. If you still feel like he's pretty calm and he's good, then we can even push the medication back.
Okay. Yeah,
Yeah.
that's what we're trying to figure out what time, because I didn't want to really affect nap time either, because I know that was like a big challenge she was going through with him is nap time.
Yeah.
I think she's almost kind of accomplished nap time with him, so I'm like, don't mess up nap time.
Let's not mess with
You
the
can't
word.
mess with nap time yet.
So, yeah, so how about we do 7 and then we'll plan for like 11.
So that's what I was gonna leave it up to them kind
Yeah.
of during the day
Yeah.
to see where they saw it most.
Yeah.
Because I'm comfortable with them two
Yeah.
figuring it out with him between 11, 12, whatever.
Perfect. Yeah. But it shouldn't interfere with nap time.
I just remember you saying 4 hours, so I wanted to make sure it was 4 hours.
And it's not exact, so, sometimes we see it wear off, which is why I just.
Yeah, because he's
let
a
it.
big old boy.
Yeah, he is a big boy.
He's
Yeah.
a big boy, can wear off.
He is a big boy. So I put the information on here. So it's
Okay.
Tenex, the generic name is Bonfify, so same medication. We're gonna do half a tablet once daily in the morning for 4 days and then increase it to twice daily. That's just to give him some time to get used
Okay.
to.
So for this week, what is it? So on Saturday, try the whole.
Yeah. Or you'll do half a tab twice a day.
Half a tab twice a day,
Yeah,
okay,
so-
and then move up to a whole one twice a day.
No, so you'll do first to start with half a tab once a day, and then increase to twice a day. So then you'll do half a tab twice a day. Does that make sense?
Yeah.
Do you mirror that?
So when he goes back to school one day. then like normal.
If you want to do that, I mean, you could go till Friday, and then you could start trying it twice a day if you want.
The whole one?
The half a tab twice a day.
Yeah, and then when will he go to a whole one?
Whole one, it just depends on how he does, because he may do well on a half a tab actually, and we may not need to do a whole.
Okay.
So that's why we start. It's the lowest dose we start, and it should be good for his age. So he may not have to do a whole tablet unless you're seeing that's not really working. Okay.
And then.
Yes, to give the medication. Yeah, and I can fill that out so that they're able to give it at school. So we'll do half a tab once daily in the morning, and then we'll do half a tab twice daily, so morning and
Okay.
afternoon,
Okay.
after 4 days. And it's just to give him some time to get used to it.
Yeah, that's fine.
Okay. I put some information about it here, so
Okay.
that you have that. And then the biggest thing to know, like I said, is the sleepiness. Give it some time. If you're seeing a lot of
That's
that.
why I'm glad we can start this week being out of school, so I
Yeah.
can kind of watch him and.
And that may get better as the medication. Typically what we see is they're a little more sleepy when we first start it, and then they get used to it, their body get used to it, and so we see less sleepiness as it goes on. So give it like a couple weeks before we really, unless you're seeing big things that you don't like, okay?
Yeah.
But yeah, let us know at any time if you feel like this isn't working. You want to stop it, just let us know. We'll be okay. Any questions, concerns?
No, I just wish stuff like this came to liquid.
Yeah.
Oh my God.
understand that.
In my head, I could go, all right, how am I gonna show this?
Yeah. And you know what, if it's becoming a big issue, let us know. You know, we can try and brainstorm and find something else that works, okay?
Yeah,
There are liquid meds,
yeah, well,
but
get it.
yeah, let's see how it goes, and
I'm
then we'll,
thinking if I just put it in something that he's eaten already,
yeah,
I'm really not telling. His thing is like when he sees something,
Yeah.
he's done.
it's over, yeah.
So I'm more like you gotta sneak it in like his food and not let him know type thing. Because he's one of those kids like once he sees, like yesterday, he'd been eating White Castles, right?
Yeah.
But he's seen that one onion on there and he was like, nope. I'm like,
Yeah.
they've been on there, but he's seen it. He's seen it.
And it was over, and it was over.
Yeah, I was like, all right.
Don't let him see it. Don't let him see it.
So,
Hannah,
And definitely keep it locked up for him.
Yeah.
Like I said, it's a
Hannah?
medication.
Does Johnny like applesauce?
he eats stuff at school he wouldn't eat at home. So
Well,
that's
no,
the
I know.
thing.
Well, no, I really can't think like if he has a special chair that he always sits at. So it happens to be far away from me. But does he eat applesauce pretty well? Because I'm thinking about, making sure that we can get that.
I think he does at school. He won't touch it at home, but he likes like that. And I know he eats pudding, but
Yeah.
other than that,
He
I'm
does?
sure he does at school. I think he does.
Or peanut butter, if you can do it.
You just want to make sure we have on hand what will be
Yeah.
best. to
I think-
give it.
So I will go get applesauce.
I don't know. Yeah, I don't know that he.
I don't think he really eats it here.
I don't
I
think.
think he's such a picky eater. That's the thing. Like at school, he would eat things he wouldn't touch at home.
Yeah.
So, and I don't really know what you all have. at
Does he eat yogurt?
No. No, actually, yeah, he will. He'll drink them yogurts or the yogurt stick things. I'm sure he would.
Okay.
Try that.
Also, I emailed the medication form that we need for school to Shannon.
Okay, perfect. Then I will fill it out and I will send it.
Hannah, you kind of know the drill on we'd need the medicine in its original bottle with the prescription on it, to go along with it.
Yeah, if you ask the pharmacy, they'll give you an extra bottle with the label on it for school.
Yeah, ask him for another
I
bottle.
didn't know they did that. Okay,
Yeah,
sounds good.
Okay.
Figure it out, one day at a time.
I gave you an extra month refill but it's either us or your pediatrician needs to see you in a month. And we're fine with either.
She sees him, I think, here soon for a well check anyway.
Perfect, yeah. So you should have this month and the next month too, but just in case, just to get you through.
Okay.
But yeah, typically we recommend a month after starting.
Sounds good.
And then we will see you back in 6 months.
Okay.
But don't be a stranger. Please reach out anytime to kind of let me know how things are going.
So, and then we feel like it's not enough to talk to the pediatrician. and
So
they'll-
if you
and they'll
feel
look
like
at it.
you want to do something different, you talk to them first, see what their comfort level is. But I think they probably will. Yeah.
Okay.
But you're connected with us already, so you'll see me anyway.
Okay.
So you
Sounds
can
good.
just schedule something earlier than 6 months if it's not working.
Okay,
Give it a
sounds
couple weeks to see how it goes.
good. Yeah,
Okay.
I'm gonna get everything.
Yeah. Okay.
Alright.
How does it sound? Good plan?
Yeah.
Okay. It was nice to meet you guys again. Okay. I know this is a lot of information, so if things don't make sense, reach out to us. If we can't answer your question, we'll find someone that can. Okay. Thank you for coming.
Sounds good.
I'll leave you with all of this. And we did say we were gonna get other school reports. Can you wait 10 minutes so that we can read that again for the
You're
school? Okay. All right. Should I give that to
Yeah.
the school?
Yep.
Perfect. This
There's
is psychology
safe
server for the school. Okay, let me grab PT, OT, and speech for school too, okay? Okay, and then you'll be on your way, I promise.
Thank you all. Thank you for your patience. He's definitely got a good team around him.
Yeah, we had a lot of people helping out and
Yeah.
trying to get him where he needs to be. That's what we're all,
Yes.
That's what we want.
Yeah.
and going to preschool next year, and we gotta make sure we got something in place to help him get through that too. So.
Yes.
Definitely.
Yeah.
Okay, I'll be right back with the other things and then you'll be all set,
All
okay?
right, thank you.
Thank you guys so much. I'm gonna stop recording now, okay, guys?
Thank you so much.
Thank you.